Welcome to the Happy Doc, the voice of fulfilled physicians. This show is about bringing inspirational, creative, successful, and happy health professionals to you. Get ready to learn how you can be a happy doctor too.
Hello everyone, and welcome back to another episode of the Happy Doc. As you can plainly tell, this isn't the usual voice you're used to hearing. My name is Alex Icono. I'm a third-year medical student at PCOM and the audio tech guy for the Happy Doc. I'm also interested in psychiatry like Taylor, so you guys will probably be hearing a lot more from me as time goes on. Getting a bit into this week's episode, Taylor will be talking with Diane Evans, an OBGYN doctor who travels the world as part of her work with Comp Health, a Locums 10A company. Also, Dr. Evans is part of the Passing Your OBGYN boards, where she helps mentor clients and prepare them for their ABOG and AOBOG oral boards through live online webinars. And guys, these webinars are super awesome, so if you're really thinking about OB and want some help, definitely check them out. Also, we wanted to try out something new this week by breaking the podcast into two parts to see how people like these shorter, sweeter episodes that more easily fit into the regular commute time. As such, we want to hear from you, our wonderful listeners, whether you prefer these shorter episodes that are multiple parts or one longer interview. So if you guys could just leave a comment on the episode with your thoughts and suggestions, we would greatly appreciate that. So, without further ado, let's listen in to Taylor and Diana. Take it away, Taylor.
Hello, everyone, and this is Taylor from the Happy Doc. I am really excited. We have an amazing next guest with us today, and that's Dr. Diane Evans. So she is a practicing OBGYN physician, and she's also involved with the OBGYN boards. She's part of some amazing programs, including the American Boards Review, and she also has a program called Passing Your OBGYN boards. We're going to definitely touch on those topics. And she's also part of Comp Health, which is a locum tenens company. We're going to dig all into all this stuff. So without further ado, Diane, can you introduce yourself?
Hi, yep, thanks. My name is Diane Evans, and I appreciate you having me on the show today. One of the things I wanted to let everyone know about is I'm an OBGYN, but I'm a non-traditional student. So I was a molecular biologist by my first career and went back to medicine. And in doing so, I ended up having all of my children in training and having 4 children. We love to travel a lot, and I've created a life for myself using lots of really good techniques in order to enhance my income and to make my life a lot more fun with my family by doing working vacations and also finding something I really love, and that's not only maternal fetal outcomes and improving OBGYN care for women through our country, but also to make a big impact and difference for people taking their OBGYN boards. And I've been doing this for about 8 or 9 years, and I've met some amazing people along the way, not only in helping people pass their boards, but I've also had the ability to practice at about 30 hospitals, and it's amazing all the different things you can learn just part-time, going places, meeting new physicians and nurses, and learning so much more from all of these other higher professional people in different areas of the country.
Wow. I'm really excited to speak to you just after that introduction. That's amazing. And I think a big theme that we talk about, especially on this podcast, is how a lot of people perceive that your career needs to be very linear. And, you're kind of discussing the many options that one has in medicine. So I definitely want to dig into that. But before that, as an icebreaker, I saw that you have a really big interest in cars, specifically Corvettes. How did that start for you?
Well, basically, I've always had an interest in Corvettes since my early 20s. And my first car was actually a 5.0 Mustang, and I went to San Diego, and during the drive, I fell in love with a Corvette, and I've had an 88 Corvette, and then I got a 75 Corvette, and then through all my Locums work, I actually went and I walked into the dealership, and I walked out 3 years ago with a $120,000 sports sports car. So that was really nice, and the car's paid for now, and it's beautiful. And I love showing cars. I love Corvettes. That's just my hobby. But I think the really cool thing too is I also like to do like low speed racing, and I'm certified in that. So it's a lot of fun because I have a lot of different interests. And if I didn't do locums, I definitely wouldn't be able to have 4 children and 3 Corvettes. So,
wow, I love everything you just said, and that's a big theme that we talk about is the fact that you need to preserve your interests, and that's definitely a reason why I wanted to ask you that question. It's so awesome that you're able to have a family, that you're able to have all of these really great cars, and it seems like it's paying off quite well. So a lot of good things on that end of the perspective, on that end of the spectrum. So let's dig into a little bit about Comp Health and specifically locum tenens. So how did you find out about this program, and how does this allow you personally to really take a lot more ability to navigate your life?
That's an excellent question. I really think people look as locum tenens physicians, they really look down and say, geez, they're really part-time physicians. How much of an impact can they make? But you can make such a huge impact going to a small community, even if it's covering on the weekends. And I have a lot of friends that I go and I locum for them. So they call me up and they say, Diane, we really want you to come. I need to leave. I'm the only OB in this town. Can you come and can you cover me for the weekend? And so I've been doing that for 5 or 6 years for a few of my friends. But the big impact too with locums is, I think a really good point is you need a really good company. And there's so many different locum companies out there. There's Comp Health is actually the largest locum agency, and they have an amazing facility. It looks almost like Google. So you walk in and there's video game rooms and there's smoothie bars and there's places for their families to hang out and a full gym with amazing equipment in it. And they have so many perks for all their employees, including working remotely. But the thing about Comp Health and any locum company is you have to have a really great recruiter. And so my recruiter is Trish Reinhardt. I love her to death. She's absolutely amazing. And the thing about locums that you need to know is sometimes you get a job and something changes. Maybe they find a permanent doc at the last minute, or maybe they all of a sudden find out that you're going to be the only physician there and they thought they were going to have 2. So you have to be a little bit more patient. And if you have a great recruiter, there's been times where a job has fallen through in Minnesota. Would you be open and willing to go there? And the other thing too about locums is it's great because not only can you take a locum job in a facility that you really want to explore more of, but you can actually go to amazing places. So I took part of my vacation from one of my jobs that I was working at previously, and I actually went to Kauai in Hawaii for 10 days, and I covered an OBGYN that was going on CME, and that was fun. I made it a family working vacation. And so I think one of the things people need to know about is you can definitely work a full-time job, do locums on the side to really help out another community and another hospital, and there's such a big need, especially in my profession, for OB.
Wow, I love that. And I just like the fact that this sort of work brings out so many options, and it's almost like you can get a little mini vacation while you're working, such as when you went to Kauai. And I'm a little bit more familiar with this, but for the younger students out there who might be listening, can you explain what locums means exactly, just to explicitly state it?
Right. So what locums means is it's basically part-time physician. Now, some people, when they get out of residency, they don't know what they want to do in terms of location. Maybe they don't have children, they don't have a husband or a wife yet, and they really just want to explore the country. You can get involved with Trish Reinhardt at Comp Health or another locum agency and really get an idea of, do I like this facility? Do I like this location? What are the pluses and minuses? You can take 6-week assignments, 3-month assignments, 6-month assignments, year-long assignments. And if they really like you and it's a good fit, you can transition to be a permanent doctor. So it's a great way to get around the country and see all the things out there that you probably wouldn't see if you just took a contract with one hospital.
Wow, that's awesome. And as a younger student, I think, and especially the millennial perspective, we definitely like to have our options open. I can speak about that personally. Like, I like to have my options open, and it's great to have this ability to have a little bit more of that lifestyle navigation. And so I love the fact that we can do that through these companies such as Comp Health and the Locum Tenens companies. That's really great. So something that you had mentioned earlier was the fact that you take almost these like work vacations. Can you speak about that a little bit more and how that's been helpful for your career and your lifestyle?
Right. So one of the things, and this is important if you take a full-time job, and with any job that you take, you have to be honest and upfront with your employer, and you got to let them know that the reason that you want to do a locum or a part-time job is really to enhance A, your surgical skills, and B, maybe getting exposure to certain types of patients or procedures that you might not have a chance of doing at your current facility. So let me give you an example. There's hospitals that I've worked at where I am not allowed to do vaginal births after cesarean. They frown on it. Now, personally, I really like that. I like avoiding the primary C-section for a breech patient, so I'll do a version. But there's certain hospitals that have rules that say, we really don't feel comfortable doing vaginal birth after cesarean, and so I use locums, or I have in the past, to go out to other facilities so I can continue to provide that service. Because as a physician, what happens is if you don't use that skill within 2 years, you're not certified to do that anymore. So it makes a huge impact on what you are credentialed for. The other thing that's important too is I like to do cystoscopy, I like to do stents. So basically I have a large uterus, I'm concerned that I might injure the ureters, or I have an endometriosis case. I can look inside the bladder, take little stents, put them up. And in some institutions, and I've been worked at a couple where that was a urology only procedure. Well, if I go to these smaller hospitals and I'm helping out another OBGYN doctor and there's not a urologist there, I get a chance to do those procedures. So that's one of the benefits of using locums, to go out and to continue to be proficient in procedures that you might not be able to do.
And we'd spoken earlier about this as well, was this concept that you can not only work at one facility, but you can also explore how it is to be in a rural setting versus an urban setting. The fact that you can build out all of these skills, that's really incredible. Can you speak about just beyond just uses of skills, just going to all these different locations and how that's impacted your career?
One of the things I can say is I'm comfortable walking into any hospital and being able to do any procedure based on the different hospitals I've been at. So most hospitals are set up in certain ways. There's certain people that you need to know how the infrastructure of the hospital works. So, for example, there's usually a house supervisor who's a nursing kind of like administrator that manages all the inpatient and calling the OR teams. And so for me, every time I go to a new hospital, I get to know the nursing supervisor, and the nursing supervisor will tell me what is usually done, when the nurses usually call me for a delivery, what the parameters of the hospital are, if they want me to be in-house at a certain dilatation for delivery. And by doing that, I've been very successful at going from hospital to hospital to hospital and having basically uncomplicated calls and very good outcomes on all the patients because I know the different procedures. And the nice thing too about this is I get a chance to see how things are done a little bit differently. So for example, I just was at a wonderful facility out in Minnesota, and the OB there was fantastic. And he told me, Diane, I have a little trick when I do my postpartum tubal ligations. I use this very small plastic retractor called Alexis, and it goes in and it makes my tubal that much easier. And when I was in the OR people informed me of this. They said, oh, Dr. Evans, try this. The other OBGYN loves this. And I tried it, and it made all the difference in the world. The surgery it took me 5 minutes instead of my 15 minutes to do my tubal ligation, and it was amazing. And it's these little things that if I hadn't had that experience, I might not have had that in my repertoire of learning. And so I think doing locums, it really helps you not only in meeting people and getting exposure to new procedures, but really getting a chance to see what other hospitals are doing and what the standard and how the standard of care is emerging.
Wow, and that's great. Even on your end, when it comes to how you might help, the profession of OBGYN as a whole, having these various exposures gives you the ability to really speak about how completely different healthcare systems are operating, and then you can kind of quote like cherry pick the best parts of each system and implement it and teach other people, these really great procedures and operating procedures such as the one you described. To take a step back here, we're starting to talk about locums and how that's really impacted your life with your career. But why did you go into OB-GYN in the first place?
It's a great discussion, and the reason I really went into OBGYN in the first place is basically from personal experience. I was a research scientist at NIH, and I had done an infectious disease rotation at the Cleveland Clinic and fell in love with the Cleveland Clinic and really thought that was what I wanted to do. And by my third year of my medical school, my OBGYN rotation, she really told me, Diane, I think that OB is really where you need to be. You have a lot of empathy based on your experiences, and I think you would be a great obstetrician. And it was my third year of medical school that I made that decision that I was going to switch from internal medicine focus to OBGYN and women's health. And I really think I've made a huge difference just in that because I can empathize. I've been through a lot of the infertility treatments that my patients go through. And I think it's just really helped me to be able to relate to people. So it's been a good choice for me. I still want to get a little bit more involved in the research side. And, I'm going to make that my priority. And my life's going to be changing fairly soon, so hopefully I'm going to have a lot of new adventures and be able to do everything I want to do by the end of my career.
Sure. And actually, since you brought it up, so what is the next part of your career?
Well, the next part of my career is something I've always wanted to do, and that's to join the Air Force. And hopefully that's going to be my life career. I applied basically 18 years ago, and my pregnancy test was positive, and the Public Health Service accepted me, and I wasn't able to go into the military. So I had four children in training, and my oldest daughter is 18 now. She's starting at University of Colorado in Denver, and she's really excited. And I have 3 other sons. My youngest is 8, and then my oldest son is 14, and I have my IVF baby Brandon is my 10-year-old right in the middle, and he's super smart, and I keep telling him, you definitely need to go into medicine. And I think the one of the great things about medicine is there's so much that you can do to explore, and so there's so many different avenues. So for the residents and especially the medical students out there, I know you all feel that you're drowning right now with all of this information overload that you're getting, but basically just realize that there's a light at the end of the tunnel, and you can make your career whatever you choose it to be. And you can start out in one position, you can do locums for a certain amount of time, and then you can end up in your final career path like I'm going to be.
Wow. And I, first off, I love the fact that you have this family and you're able to do so much. I have to say, like, not to flatter you, but you really are an inspiration for so many reasons. You're helping so many people. You're a practicing clinician, and you balance that with your family work. You're like a superwoman. It's pretty amazing.
Well, coming from you, I think that the listeners out there need to know that you're fairly talented yourself. So I might hold a close second to you.
No, stop it. Now I'm gonna blush. So no, seriously though, that it's really impressive, and I think it's just so great that you're able to balance all of these different aspects of what you do. And I guess this would be a great place for us to start to talk about, your program with boards and how that's kind of built. So can you give us kind of a picture of how you help, the residents and people trying to certify themselves in OBGYN? Can you give us a picture of your program and what you do?
Right. One of the things I can tell you about is I started originally with something called Student Doctor that's still out there, and it's a platform that basically helps medical students and residents and even attendings to come together and talk on important topics that are very challenging. But it's developed from there to me actually helping doctors pass their certifying exam, and that used to be called the oral boards. And the reason I got involved in that is there was friends that I knew and friends of friends I knew that were at the point where they were at their 5-year mark of their hospital, and that's where you really have to be board certified to continue hospital privileging. And they were on their last attempt because they procrastinated taking their boards, and they waited until their 4th year. They failed their 4th year. All of a sudden, they're retaking it their 5th year, and they're nervous. They're like, "Oh my gosh, Diane, I don't know what to do. If I don't pass this test, I'm going to lose my job. If I lose my job, I'm not board certified. If I'm not board certified, I can't work. I have to take off a year to sit back and take the written boards again, and then I'm board eligible, and I need some help. I need some guidance." And I've worked with some really great board review companies in the past, and basically when I took my boards, I went to the ABC board review course, I went to the Exam Pro course, I went to Dr. Wall's course, I got the perinatal board review course notes, and I got mentoring from Dr. Doss, and really kind of spent, I don't know, maybe about $30,000 trying to pass my boards. And it was successful, but what I learned is, there needs to be someone out there to help people like these friends of mine that are just at their wits' end, that are so upset and have so much PTSD that they don't know where to turn next. And so in 2011, I started working with Dr. Doss in developing some online webinar programs, and it's just flourished into this wonderful symbiotic relationship. I got double board certified, so I'm certified osteopathically and allopathically. And the wonderful thing now is I get a chance to go out there now and help my my fellow colleagues pass their boards. And so I'm really excited about it, and I think it's going to be wonderful because I want to be that go-to person that any OBGYN out there can come and send me an email and say, "Hey, Diane, I don't know what to do. Can you help me? This is what my story is." And going to these big tertiary centers, one of the things that I've learned is there's a lot of different ways to create time in your day to actually create a study schedule for yourself. There's a lot of things based on the EHRs that you can use to find information for your case list. And from going to lots of different hospitals as a board coach, I know basically how to run every EHR, and I think that's important when I'm talking to my clients, because I can say, oh, do you have Epic? Do you have Greenway? Do you have Cerner? And there's like, oh yeah, I have Epic. I said, well, on Epic, a lot of times if you have a depression case, it's actually the nurses that are putting all that information in, and so that's really helpful, I think, for my clients to know that I can understand not only what their working environment is, but also how my experience on the outside have really helped me to try and coach other OBGYNs into figuring out what the best study schedule is and how to use their existing electronic medical records to help look up patient information, and if according to their call structure and their hospital structure, what's the best way really to get a study schedule together so they can make time and they can successfully pass their boards. And I think if I hadn't done locum experience, I think that makes it harder for me to advise all my clients.
Awesome. And I love the fact that it kind of as an offshoot, you doing the locums work has actually amplified your ability to teach, the other physicians out there. So how would, I'm not in OBGYN, but it sounds like you would be a fantastic mentor.
I agree, Taylor. Diana sounds like a wonderful mentor. Unfortunately, this is the end of part 1 of our 2-part interview with Diane Evans, everyone, so tune in next week for part 2 of the interview, where we will continue discussing cool topics with Diana, including helping with board studying and how to reach her and much, much more. So make sure to tune in again next week. Again, please leave us a comment if you want us to continue with these 2-part series, or if you want us to go back to our previous methods. Thanks again, and here's Taylor with his infectious laugh and catchy song.
Hey guys, we hope you enjoyed this episode, and we want you to definitely subscribe to our social media channels. Check out The Happy Doc on Facebook, iTunes, Twitter, and Instagram. Please like, subscribe, share, and send us feedback. And please check out the website, www.thehappydoc.com. Again, we hope you enjoyed The Happy Doc, the voice of fulfilled physicians.